A standard checkup today looks very different than 20 years ago. We are watching the most significant expansion of pediatric medical practice in a generation. Meet Carlos. He's 15, and he's been visiting a school-based clinic for a week of severe chronic stomach pains. The traditional response focuses on the physical hardware: run labs, check reflexes, and find the malfunctioning part. But for Carlos, the physical exams show nothing. The relevant data is outside the body. Carlos was with his parents and 4 other families in a cramped migrant housing unit on a rural farm. It is a home with no heat, no air conditioning, and no internet access. Prescribing antacids for a stomachache is medically incomplete if the patient is sent back to an unheated, overcrowded room. Without addressing the environment, the physical symptoms will simply recur. Widening disparities in our communities show that genetics only tell part of the story. A child's biological trajectory is dictated by their ecosystem, making environmental awareness a core clinical requirement. Modern clinics now screen for adverse childhood experiences, or ACEs. These are specific environmental threats like extreme poverty, chronic neglect, or witnessing household violence. Facing these threats without a supportive adult buffer triggers a severe physiological reaction. A hormonal flood of stress chemicals saturates the child's internal systems. Prolonged exposure literally miswires the developing architecture of the brain. Neural connections fray and reconnect in chaotic, maladaptive patterns that can impair learning for a lifetime. This trauma even reaches the cellular level, triggering epigenetic modifications that change how a child's DNA is expressed across their lifespan. Because environment physically alters brain structure and cellular biology, the diagnostic focus is shifting. Doctors are moving past the question of what is wrong with you to investigate what happened to you. This shift has led to the adoption of social determinants of health screening as a primary clinical tool. Standardized questionnaires now look for hidden metrics that predict future illness, including severe food insecurity, chronic housing instability, and low health literacy. Models like HealthySteps are being integrated into practices to intercept these risks during the first 3 years of life, the most neuroplastic window in human development. Operationally, this means adding child development and behavioral health experts directly to the standard primary care team. They work alongside the pediatrician during every well-child visit. These integrated teams allow medical professionals to identify and neutralize environmental risks before they solidify into permanent biological damage. Consider a child suffering from severe chronic asthma triggered by toxic mold in a neglected apartment building. An inhaler provides temporary relief, but the treatment fails the moment the child returns to the moldy environment that caused the attack. To address this, clinics are forming medical-legal partnerships. Doctors are now embedding lawyers into their medical teams. These attorneys can take direct action, forcing landlords to remediate the environmental hazards that medications alone cannot touch. This model treats legal representation and housing advocacy as direct medical interventions, essential components of a modern treatment plan. While these interventions happen in small exam rooms, their ultimate impact is visible on a national scale. Research suggests that improving a country's health literacy by just 25% could save $12 billion every year. By preventing childhood trauma now, we bypass the immense future costs of adult chronic disease and medical debt. A healthy childhood foundation creates a more resilient workforce. It leads to fewer sick days, higher labor productivity, and a direct increase in the national GDP over the coming decades. This is the Eco-Biodevelopmental Framework. It is the new foundation for the basic science of pediatrics. The center intersection proves that a child's social ecology cannot be separated from their physiological biology. The environment and the physical body are 2 parts of the same system. So if a doctor asks you about your housing situation or the stress in your life, they are doing more than just being thorough. They are actively shielding your child's future health. The modern pediatrician functions as both a medical mechanic and a social architect. They are designing the health of the individual to ensure the stability and productivity of the entire society.